Welcome back to the CPC review. Today we're going to be covering medical terminology, and learning medical terminology can seem complex at first, but once you understand the basics, it's like learning any other new language. Every medical term is composed of different parts: a root word, which tells the main story, prefixes, which set the scene, and suffixes, which bring the conclusion. So for example, cardiomyopathy breaks down into cardio, which means heart, myo for muscle, and pathy meaning disease. So cardiomyopathy simply means heart muscle disease. As far as anatomy, understanding the structure of the human body helps us appreciate the complexity and framework on which medical coding is built. And knowing med terms and anatomy is crucial in fields like medical billing and coding. Coders need to translate medical records into codes that are used for billing and for healthcare documentation and data. So for example, knowing the difference between epidermis and dermis helps in accurately coding a dermatology procedure. Now, as far as the CPC exam is concerned, there are 4 questions of the 100 questions on MedTerm and 4 that are on anatomy. Now, there's some great study tools out there for medical terminology that help you practice the root words, things like flashcards. Those are great because once you know all of the different structural pieces, you can piece pretty much anything together. You can even create digital flashcards. If you have some of the AAPC editions of the ICD-10-CM book, you can create digital flashcards there. You can use digital flashcard programs online. If you want to supplement, I suggest getting Medical Terminology and Anatomy for Coding. This is a fantastic resource. This is the 3rd edition. Get the 4th edition if you can, because it's just a little bit more updated. You can also go onto the Vital Source website and rent this for 90 days for cheaper than if you want to buy it. You can also get the ebook edition. But if you want to buy the paper book and support the channel, I will link the Amazon link below, and that way I will receive a small commission for you purchasing it through Amazon. And let's actually take a look at some of the resources that are already available. There's a chance that we're going to be moving to ebooks for the AAPC certification exams. So I'm probably going to start demonstrating more with ebooks. Now, for copyright purposes, we're not going to show the entirety of the books, but I do want to demonstrate some of the small pieces. Now, if you have paper books, and you're allowed to use paper books when you're taking your exam, because again, when I'm recording this, you can only use paper books. That may change in the future, and you might be watching this 2 years from now. But for the paper books, I like having the tabs because I can look right at the anatomical illustrations that are already in my book that are tabbed in my ICD-10-CM. Now, for the ebooks, you can scroll right through your table of contents and see the anatomical illustrations. So for my edition, it starts on page 61. And again, this is the AAPC edition. Depending on what edition you're using, they may or may not have anatomical illustrations. If it's a cheaper version, they might not include them. But the cool thing about the AAPC ebooks is I can scroll through all of these different anatomical illustrations that they have available. And they have pretty much every body system: cardiovascular, digestive, ears, nose, throat, reproductive, etc., etc. And you can make notes here. So again, as of the date of this recording, we don't know if and when they're going to allow ebooks, but you can do things like make notes in your ebooks. And I honestly, to be honest with you, I don't know if when they do allow ebooks, if they're going to allow a blank ebook. That's kind of what I'm hearing, but it's still worth knowing how to write notes in your ebook. So let's say I get a question on my exam on the blood flow of the heart. I can click here on my circulatory system on the cardiac cycle. And maybe if you want, you can just go ahead and write some notes in here. Now, you can't notate the picture itself, but what you can do is if you wanted to highlight maybe cardiac cycle and add a note in there. And if you wanted to Google what's the blood flow of the heart and paste it in there, you could. So I'm not going to go through for this video all of the different ins and outs of MedTerm because there's so many other great resources in there on how to refresh for that. I want to go over some of the resources and refresh on how to utilize them and where they are. Now, there's also some information that you can access as far as MedTerm and anatomy in your CPT book. So here they have the illustrated anatomical and procedural review, and they do include some prefixes, suffixes, the more commonly used ones, but it also gives the guide here to where all the anatomical illustrations are. So things like your body planes, your muscular system, circulatory system, female-male anatomy, eye anatomy, and it even gives a guide to where all of those procedural illustrations are as well. So again, if you get a question on the body planes and you're like, I'm not 100% sure on this, remember that you have these resources, these illustrations in your books that you can utilize. Even things like your vascular family illustrations in Appendix L. And then what about our often forgotten HCPCS book? Again, I have the AEPC edition. If you have a different edition, there may not be any illustrations. And sometimes the cheaper the editions, the less bonuses they have. So here in Appendix C, we do have a list of abbreviations. So there are some abbreviations available here that maybe if you forget what they are, you can reference them in your HCPCS book. And this one also has the anatomical illustrations, but they're essentially the same ones that are in the AEPC ICD-10 CM edition. And now I do want to go over just a few sample questions, 5 of them, of some things that might be similar to what you would see on the CPC exam. Starting with question 1, we have, what is a laparoscopy? Is it A, a surgical procedure to examine the heart, B, a diagnostic procedure to examine the joints, C, a surgical procedure to examine the abdominal cavity, or D, a diagnostic procedure to examine the lungs? So we know that our scopy is when we're using a scope to look into something, and lapara actually means flank or side. So the laparoscopy is a surgical procedure to examine the abdominal cavity. Next, we have question 2. What prefix means around or surrounding? Is it intra, peri, retro, or sub? So the prefix that means around or surrounding is the term peri. So for example, the pericardium refers to that membrane that is surrounding the heart. Question 3, the term hepatomegaly refers to, is it A, enlargement of the kidney, B, inflammation of the liver, C, enlargement of the liver, or D, inflammation of the kidney? So hepato is our enlargement. Inflammation would be our itis, remember? So we're looking for something that has a hepatomegaly. So hepato is the liver. So hepatomegaly is the enlargement of the liver, which would be our option C. Question 4. Which of the following terms refers to the surgical removal of the gallbladder? So removal, what is that? An ostomy, ectomy, otomy, lithiasis. So we have A, cholecystitis, B, cholecystectomy, C, cholelithiasis, or C, choledochotomy. So our surgical removal is our ectomies. So that alone kind of tells us what we're doing, right? So cholecystectomy is the term for the removal of the gallbladder. So cholecyst is our gallbladder, and then ectomy is our removal. And lastly, what does the term myocardial infarction refers to? Is it A, a condition characterized by high blood pressure, B, a surgical procedure on the heart, C, a blockage of blood flow to the heart muscle, or D, an infection of the heart valves? So myocardial infarction is also referred to as a heart attack, and that's the blockage of blood flow to the heart muscle, which leads to tissue damage. So myo is our muscle, cardio is our heart, and then infarction refers to tissue death due to lack of blood supply. So that would be our C, a blockage of blood flow to the heart muscle. So that's it for today. I hope you enjoyed exploring the basics of medical terminology and anatomy with me, and I hope you maybe learned a little something new. If you like this video, don't forget to give it a big thumbs up, subscribe for more content, and share it with your friends who might find it helpful. Lots more videos coming, reviewing on different sections of medical coding and specifically towards the CPC exam. If you have any questions, let me know in the comments below. Otherwise, I will see you guys in the next video. And until then, just keep on coding on.